I mean, healthcare is certainly a hot button issue in the upcoming presidential election, as we have been talking about. And Rick recently sat down with New York Senator Kirsten Gillibrand and talked about Medicare for all. What did she have to say, Rick?
Well, she does favor Medicare for all, but in the debate, when the question came up, do you favor getting rid of the private healthcare system? If you do, raise your hand. She did not raise her hand, so I asked her about that. Let's hear what she had to say.
That's just been shown by history. If they want to compete, let them lower their rates, let them cover more stuff. Medicare is good. It covers everything, and we're going to expand it to cover really everything. So I dare them to compete. I doubt they will. And to the extent they want to participate in some market in the future that there's interest in, that's their choice. But I don't think you have to worry about them, because what you want to get to is Medicare for all as the single payer that it could be as an earned benefit, so that no matter who you are, you buy into Social Security, you buy into Medicare, both your retirement and your health care are both social safety nets that are there for you.
So what she's saying is let anybody who wants to buy into Medicare. In other words, you would pay premiums as you would for any kind of other kind of insurance, and then let Medicare compete with the private insurance companies that are, taking a profit off the top, so that if you're the consumer, you can say, well, I have the choice to be part of the plan that my company offers, and here's how much that would cost, or I could buy into Medicare, and here's how much that would cost. And she says that she doesn't think the private insurance companies will be able to compete with that, simply because they have to account for a profit, which Medicare does not. I think there is a competing argument, which is that private insurance companies are more efficient than government programs and than Medicare.
I'm sure they are.
And that they, because they are able to find ways to control costs and take costs out of the system, that they could compete. On the other hand, there are so many middlemen in the healthcare system that you can argue that's not really taking costs out. There is one other wrinkle here, which is when you go to a doctor or a healthcare provider covered under Medicare, that is normally a person who's in the private sector. Right. Those are not doctors who work for the government. So what Medicare does is really kind of an administrative insurance type program, but it contracts with the private sector. And Medicare pays doctors a lot less than private insurers do. It pays hospitals a lot less. So if you had a lot of people flooding into Medicare, and Medicare is paying a lot less for doctors and hospitals, you've got a major unintended consequence, which is that you're suddenly putting a lot of financial pressure on this other part of the system that is doing okay right now. So you have to account for that. Again, that just tells you how complicated it is.
And that was just a snippet of your conversation. Right. Currently, she's polling between 0 and 1% in national polls right now.
Right.
When you think about her in the sea of candidates, does she have a fighting chance? I feel like a lot of the write-ups recently have been, why we're ignoring Kirsten Gillibrand. She's so boring. Is nuance dead? All of this, that she isn't that interesting, right? Like, a lot of what she's saying may be smart, may be well thought out, but she doesn't have the charisma, or is it sexist? I don't know. I'm trying to figure it out myself.
Especially after Swalwell dropped, I thought maybe now we'll finally. But then of course today you get Steyer is in.
Yep.
So I was hoping now that the pool will finally begin shrinking instead of continuing to expand.
The pool is going to shrink for sure. We have more debates at the end of July. Some of the candidates will not qualify for those debates. After those debates, some of them will perform poorly and their fundraising will dry up. So by the end of the summer, I think we'll have we could be under 20, let's say, by the end of the summer. And then we figure out who the real survivors are. I mean, we'll probably end up with fewer than 10 candidates who are really competing in the primaries. Kirsten Gillibrand is embarking maybe today on what she calls the Broken Promises Tour. She's going to some swing states like Pennsylvania and Michigan and Ohio, and she's going to be talking about promises President Trump made that he has not kept. So I think she's going into attack mode, and she's probably trying to get a little bit more attention.
Yeah.
And I think the leading candidates right now are basically the ones who just have the best name recognition.
Yep.
I think you could argue that Elizabeth Warren and Kamala Harris have done a good job of getting more name recognition, and I think you've got a bunch of the rest who are basically trying to do that. So Kirsten Gillibrand is young. I think she's in her 40s. You got to start somewhere. And part of what some of these candidates are trying to do is establish more name recognition and just become better known for the next race or the race after that.
Exactly. The race continues. Thanks so much, Rick, for joining us.